The first thing that we noticed when I came back from the US was that whatever studies and drugs have been created from the Western population, they don't exactly work the same way, or they work in a graded fashion for our patients. As you know, India is an endogamous population. We are genetically very unique.
What novel ground have you achieved in terms of fertility at Cellsure Biotech?
Embryo assessment. So embryo analysis, we grow embryos day in, day out in the IVF laboratory. And to assess them just with a human eye is sometimes not sufficient. So we have worked on multiple AIs and embryo assessment. We have helped companies in the US, Israel, and others. 70% of women having fertility problems have infections. It's a very, very big number, highly underdiagnosed, highly undertreated group of patients, group of women. The closest thing which is connected to every organ in the body is the gut. And in fact, the gut microbiome is now known as the sixth sense of the body.
So a healthy gut is crucial it's like the soil for a healthy embryo. What practical advice do you give patients to support their gut endometrial axis? Hello and welcome to Talk to Tanya. I am your host, and today we have a truly exciting episode for you. For too long, we've focused on reproductive organs in isolation, but emerging research is showing a powerful and undeniable connection between our gut and our ability to conceive. Joining me today to unravel this complex topic is a leading expert in the field. Dr. Sayali Kandari is a reproductive and genetic expert and one of India's only embryo-geneticists. She is the medical director of Akruti IVF and Women's Hospital and CEO of Cellsure Biotech and Research Center. Her team and collaborators are involved in groundbreaking research on the impact of hidden diseases of the testis and the uterus affecting reproductive health and fertility of men and women. She is also a scientific director of Nutri IVF, focused on science-backed nutritional approaches in fertility, a prolific researcher, and an advocate for a holistic approach to fertility care. Dr. Kandari, thank you so much for joining us today.
Thank you, Tanya. It is very exciting to be here to talk about this new evolving approach in infertility.
Dr. Kandari, your journey in healthcare entrepreneurship began in 2012. Could you tell us a little about your work at Akruti IVF and Cellsure Biotech in the context of fertility?
Absolutely. It's a pleasure to be here, Tanya, and thank you for asking me about my journey. So to begin with, 2012, we started with Akruti IVF first. We built it into a comprehensive fertility center. At the same time, we decided to launch Cellsure Biotech and Research Center. The idea behind it was a passion for clinical data from the Indian subcontinent. There was a critical need for research studies in India because the first thing that we noticed when I came back from the US was that whatever studies and drugs have been created from the Western population, they don't exactly work the same way, or they work in a graded fashion for our patients. As you know, India is an endogamous population. We are genetically very unique. And we have a lot of genetic markers that are very different from the Western and the European populace. So that was our basic fundamental idea for why Cellsure Biotech came into existence. In terms of Akruti IVF, we blended both, and we are very happy to be doing clinical research for multiple companies at this point of time.
Great. And that's a very crucial observation, the need for more specific Indian data. What novel ground have you achieved in terms of fertility at Cellsure Biotech?
So I'm happy to say that we truly have pushed boundaries in that way. We begin with the artificial intelligence used in embryo assessment. So embryo analysis, we grow embryos day in, day out in the IVF laboratory. And to assess them just with a human eye is sometimes not sufficient. So we have worked on multiple AIs and embryo assessment. We have helped companies in the US, Israel, and others in this space. Apart from this, we have also worked on AI in surgical options for patients for diagnosis. More importantly, we have a big research program that is focused on the microbiome, the gut microbiome of the male and the female. and Nutri-IVF are our main collaborators in that. So in India, US, and Dubai, we collaborate with them, and we assess clinical data and create clinical studies that look at specifically looking at novel biomarkers as well as pathogenicity in the men and the females in the microbiome, and trying to look at what new modalities can be developed to treat these patients.
Okay. And the work of biotics, meaning the microbiome and its role in reproduction, is actually very fascinating. Can we delve more into this?
This is one of my favorite topics to talk about. So I'm really happy that you brought it up. So the gut microbiome in itself has been so little studied. There is data coming in from a few, I would say very few research teams are working on the gut microbiome, primarily because there is so much data generated whenever you work on it. So for even one patient, if you want to look at their gut microbiome, you would have GBs of data that comes out of the amount of microbiomes. There are trillions and trillions of microbiota in a human's body. So how does it connect to fertility? It's surprising that very, very recently, the uterus, even a decade back, just 10 years back, the uterus was supposed to be a sterile organ. Clinicians, physicians globally thought there were no microorganisms in the uterus, that it was only supposed to carry the pregnancy to term, and that's it. That's not true. We now know that it's not true. There are a lot of studies that show that there is a very complex interplay and a particular unique number of microorganisms that are present in the uterus that are driving the entire reproductive milieu inside.
So in simpler terms, you call this the gut-estrobolome-uterus axis. Am I right?
Exactly. So why is it called the gut-estrobolome-uterus axis? It's even more fascinating than just having microorganisms inside. Now, what these microorganisms are really doing, they're interacting with the microorganisms in the gut. So if you know, the bowels and the gut are right next to the uterus, physically speaking. There is an interplay of gut microorganisms with the uterus. What the gut microorganisms are really doing is, if there is a healthy milieu inside, if there is a healthy number, they are regulating the hormones of a woman's body. So estrogen is regulated and metabolized well because your gut bacteria are working well. This is a very surprising finding, but it has been now proven by multiple studies. So that's why we call it a gut-estrobolome-uterus axis, because the gut is affecting the estrogen. Estrogen is affecting the uterus and the ovaries, and female fertility flows from the uterus and the ovaries.
And how do these gut disturbances affect the uterine disturbances?
So when you have, a dysbiosis of the gut. So gut dysbiosis is a word we use when we want to say the gut is disturbed. What happens is, when you have insufficient healthy bacteria and you have pathogenicity of other bacteria. So pathogenic bacteria, harmful bacteria. So if you have more harmful bacteria in the gut, the metabolism of the estrogen hormone is going to be disturbed. Of course, there are other hormones involved, but estrogen has been studied more. Concurrently, the uterus starts to have an unhealthy environment. The microorganisms in the uterus start changing. Now, what is happening is, in clinical circles, there is a hypothesis, a vaginal ascension of bacteria. They say the bacteria is causing harm because it's going from inside the vagina to the cervix to the uterus, and that's what is causing the infections. 70% of women having fertility problems have infections. It's a very, very big number, highly underdiagnosed, highly undertreated group of patients, group of women. However, what has now been told and what we are now understanding as treating, when we are treating patients as well as in new publications, is the health of the gut will determine whether the infection ascends or not. So if you want to test for the bacteria, yes, you go through the vagina, you look at the cervix. But if you want the gut health to be maintained, for that woman to have a healthy pregnancy and a healthy birth, the gut bacteria has to be balanced. And that's where synbiotics, oral synbiotics, play a huge role. And I thoroughly believe in that.
And I think the problem most of these infections are not completely cured is probably because we don't connect it to the gut health, really. We think
Yes.
it's mostly uterus based, or like you said, the cervix or the vagina. Most of the
Yeah.
infections
Yeah.
are there.
I think so. So I have a review article on this, and what. So in short, I'll tell you what I exactly say in that review article. I was invited to write it because there wasn't enough information about the endometrial or the uterus microbiome to treating physicians or treating clinicians. And systems biology approach is what we are taught first as a researcher, because along with as being a reproductive expert, I'm also a geneticist. I also have 2 PhDs with that. So there we are always taught that systems biology, you have to really look at the human being as a whole. You can't say this organ is going to be separate. We are not just reproductive organs. Our reproductive organs are not outside our body. You cannot just treat your reproductive organs and say, oh, be on your way, this is going to work fine. It works in some conditions. But in this approach, you really have to look at the individual as a whole. And the closest thing that causes disturbances is the gut. The closest thing which is connected to every organ in the body is the gut. And in fact, the gut microbiome is now known as the sixth sense of the body.
Wow.
Because a lot of it depends on it. And in terms of context of fertility, zoning down again to fertility, we have now multiple publications in different conferences looking at this and really saying that if you give patients synbiotic with dietary and lifestyle interventions, their need for estrogen reduces during fertility treatment. Their endometrial receptivity improves. We have reports, pre and post reports. So we do extensive testing of their gut microbiome to look at whether they have harmful bacteria and how much of healthy bacteria they have. So when they are treated, some patients require 6 months, some patients require 3 months, sometimes they even require a year. So that's what we are trying to work on. We are trying to work on to see which patient would require how much of a dose. Because dietary and lifestyle interventions, as you see in the urban landscape, are very difficult for patients to make at this point of time, especially when they're trying to get pregnant and age is catching up. So definitely this is a novel therapeutic domain that we need to harness to help our patients conceive faster.
Okay, so basically, we have to treat the gut to significantly impact the uterine health and fertility. And how does this communication exactly happen? Like, what is the mechanism?
There are many mechanisms at play. What we know from publications and current studies is one pathway is metabolites. So there are trillions of bacteria. They create thousands of bioactive compounds. These bioactive compounds are utilized by different hormones of the body, and a modulation happens. So your entire immune profile is in a way, maybe not 100%, but in a way driven by these bioactive compounds that are created by these bacteria. Okay. Apart from this, like I said, once you have a healthy barrier, a healthy gut uterus barrier is necessary. If that is present, then any harmful bacteria that is given to the body, vaginally or orally, the body can fight. But if that is absent, then the problems will start for the patient. Chronic stress, previous trauma also has a huge role. So we use a lot of psychological counseling for patients, as well as, like I said, it's a multimodal approach. Lifestyle interventions are required, synbiotics are required, health changes are required, their life changes are required. They need to change their life sometimes to improve. So it's a multimodal approach, and it's a bidirectional communication between the body and the gut. Okay. Yeah.
So a healthy gut is crucial it's like the soil for a healthy embryo.
Yeah, you can say that, because the word soil correlates to the uterus so well, and patients can understand it so well when we say, and it is real, like the soil also contains healthy bacteria, and that's what makes the crops grow so well, A fertilizer, that's what fertilizers are. The natural fertilizers are the ones that that have that unique blend of good bacteria. That's what earthworms have been doing since so long. So when it comes to our uterus, the lactobacillus dominant bacteria, those are the ones that really are allowing for implantation and a healthy pregnancy till term. These are many times absent because of gut disturbances. And that is what needs correction in many cases.
This is so insightful. And what practical advice do you give patients who to support their gut endometrial axis?
It's a multimodal in approach again. We really have to speak to them. So in terms of, we have a psychologist on panel, we have a dietitian on panel, but to be really honest, patients are mostly comfortable talking to the person who is treating them. So we have these options available for them, but 90% of the counseling happens with the healthcare practitioner.
Correct.
And what we try to give them is a safe space to first express what chronic stresses they have in their life. We start with that first. We don't start with the uterus first. The uterus is, in fact, sometimes the last thing we see. We look at what mental stresses they have, what is their life like, how they can make space for pregnancy. You know, whatever the society should be actually giving them and which is absent now. We try to create like a surrogate area for them to develop that positive mindset that they want to conceive. And once we start seeing that positivity, we put them on few tests because many of the times these couples are very anxious when they come in, when they're trying for pregnancy. Mm-hmm. And when they don't have any physical parameters that are abnormal, many times counseling and a gentler approach just leads to a natural pregnancy. Okay. It happens. It happens. We have seen it happen. Just an infection treated, synbiotics for a few months, they come back naturally pregnant. And we are talking about patients who have had previous IVF failures, wow. IUI failures. So we have seen such cases. So I do have hope and positivity that this approach helps a subgroup of patients. Obviously, not everybody would fall in that category, but a subgroup of patients is really help with this.
Okay.
Yeah.
And this is not just about female fertility, is it? We're hearing more and more about gut-testis axis. How does a man's gut health influence his reproductive health, his fertility?
So it is a little different for the male in terms of we want to specifically look at the male microbiome in context of what is the sperm health, because that is what is important in fertility. Of course, men's health is a completely different ballgame. But again, like the uterus, the testis was also thought to be sterile a decade back. And again, it's not true. There is a group of bacteria that they say that is present and is helping with the sperm production. Now, when men have pathogenic bacteria present in their sperm, because we routinely evaluate men for sperm culture, not just for DNA, not just for analysis. What we are seeing is this men who have pathogenicity also have hormonal disturbances. And hormonal disturbances are caused by, in a way, the gut disturbances, the chronic stresses that they are having. So the hypopituitary axis, the hypothalamic pituitary axis, has a role to play with the gut disturbance. The gut disturbance has a role to play with the hormones. And the hormonal dysregulation is eventually what is affecting the testis, driving up oxidative stress, creating sperm DNA damage, and you have male infertility, male factor infertility. So again, a systematic approach to looking at the overall health of the male is very important.
And I've heard it's not just about what a man eats, but how the gut processes it.
Yes. So what we had seen before was that diet changes for men, they don't really drive changes much. So with the use of synbiotics, like Embryo-Geneticists is used for male fertility, along with diet, lifestyle interventions, use of fermented food. So we normally use the Stanford Gut Microbiome program, wherein we know exactly what kind of changes are required individualized. There is a big questionnaire that they fill to see what kind of food they are eating and they should be eating. So when you add in these symbiotics, what is happening is their hormonal milieu is somehow improving. Maybe we are not directly seeing changes in the semen analysis, but we are definitely seeing more patients not having bacterial counts in sperm. We are definitely seeing more patients conceiving faster. Of course, the data is still out there. We have not published it, but we want to put it as a series of cases where individualized patients who have been on synbiotics are really benefited from it.
Okay. And what would the treatment plan look like for a man with infertility related to gut dysbiosis?
So the treatment plan looks particularly like this. In the beginning, we do a hormonal evaluation. So very recently, we've had an Aphrodite criteria for male fertility. A lot of prolific researchers in the space and clinicians have worked on this criteria globally. Now, that's the criteria that we utilize for classifying men into what kind of infertility these men have. We look at the hormonal profile, we look at the semen analysis, we look at sperm DNA fragmentation. Like I said, we look at their diet patterns, their lifestyle patterns, and accordingly, we create an individualized approach for 3 months before they undergo any fertility treatment. So that's how the treatment plan looks like with us.
Doctor, could you shed some light on the Prebiome study at ASRM?
Right. So we had submitted a study to the American Society of Reproductive Medicine Conference 2024. And the study was about the use of oral synbiotics in patients who had low uterine scores, which correlate to endometrial receptivity, whether the patient will have a pregnancy or not. So it's a surrogate marker for that. And for patients whose thickness of the endometrium was not going above 6 mm. So the background of that is when a woman has the endometrial thickness, which is within the uterus, there is a lining that has to be 6 mm plus. If it is below 6 mm, her chances of getting pregnant get lower. The thinner it is, the lower they are. And these are the patients that come with repeated implantation failures and difficulty to conceive. So in this group of patients, these were patients who are undergoing ovulation induction or IUI or IVF, so multiple types of cycles for reproduction. We used, instead of just aspirin, sildenafil, estrogen, high-dose estrogen, because as you know, hormones can have their own side effects. We also supplemented oral synbiotics to a group of patients who were severely low uterine parameters, scores, as well as thin endometrium. These patients, within 3 months of oral symbiotic treatment, with no increase in dosage of estrogen, sildenafil, and other hormones and drugs, they exhibited higher thickness, their uterine scores were higher, and after the study was submitted and it was displayed at ASRM 2024, we also had further data looking at their pregnancy rates. And they had a very respectable pregnancy rate of approximately 60 to 65%. Now, this is a big change because patients with thin endometrium don't always have good pregnancy outcomes. Their chances of pregnancy are less than 20% per cycle, just to give you a ballpark figure. So just the addition of gut modulation, oral synbiotics, we ourselves were really surprised with the changes. Of course, this field of study is improving. The number of patients we had was 70, and the numbers are increasing. To add on to that, we are currently doing what is a case analysis using AI, sort of like a Gantt chart approach, and then looking at how long the patient is taking to treat her infection if she has an infection, thin endometrium if she has thin endometrium, how long it takes only with antibiotics and probiotics, and how long it takes with other approaches. So it's still in the beginning phases. We do have about 98, 99 patients in that group, and we hope to see and demonstrate that when oral synbiotics are added to a group of patients, especially the difficult category of patients who are unable to conceive because of uterine scores and thin endometrium or infection like chronic endometritis, they really fare better with gut modulation, microbiome modulation.
So we expect another paper to come out on this soon.
You can expect a few papers to come out soon.
It seems, Doctor, this has been very insightful. It seems we're moving towards a very holistic understanding of reproductive health, both for men and for women. What's the one takeaway that you would like from this entire podcast, the audience should take away and really pay heed to?
I think the one thing I want clinicians as well as patients to take away from this particular podcast is that we are not just our reproductive organs, we are individualized human beings and we have unique needs. And in terms of the gut is a central player in improving outcomes. Surgery has a role, fertility treatment has a role, clinically evidenced medicine has a huge role. The new data that is coming in from gut health and improving gut health of their patients, women and men both, is going to herald in the new therapeutics for fertility and going to improve outcomes for these patients. So I want the clinicians and the patients to take heed of this and pay attention to their gut health.
That is such a powerful and thoughtful message. Thank you so much for sharing your expertise with us today. I wish you all the very best for your future endeavors, and thank you so much. We really appreciate the service that you're doing, not just to your patients, but to society at large. I hope to speak to you again soon. Thank you so much.
Thank you, Tanya.